Hey everyone, Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas, coming to you again this week with a new video, and this one's called, Does Going to the Chiropractor Hurt? Now for some reason, some new patients at our Amarillo Chiropractic Clinic, they think that going to the chiropractor is going to hurt, like it is really going to be painful. Not only that it hurts, but they're worried that it's awful and painful and basically traumatic on some level. And I'm here to ease your concerns and help you understand exactly what going to the chiropractor is like. Well, at least what it's like to come see me here at Creekstone Integrated Care in Amarillo. I can't really speak for every chiropractic office, not even in Amarillo, much less the state or the country. However, I can definitely tell you what you can expect when you come to our clinic. The first thing to think about is that not all patients are the same, and not all chiropractors are the same. Some patients have an extremely low pain tolerance. Honestly, though, I have to say, we hear, I have a high pain tolerance. We hear that from patients all day, every day. But the truth is, almost all of them are no different than the rest of the patients. Also, it's important to note that the popping noise is not an indicator of a successful treatment. This is really important. We can get really caught up in the idea of wanting to hear the pops when we go to the chiropractor. But the truth is, the noise is just a result of gas bubbles releasing from within a joint. Sometimes the gas is just not there to release and to make that noise. And now that doesn't mean the joint was not moved, which is the primary goal. It doesn't mean that the movement dysfunction wasn't addressed. It just means there was no gas to give us that amazing popping noise we all love to hear so much. So insisting on a chiropractor getting a popping noise out of your back or your neck is really a quick way to getting sore. It's also a good way to be disillusioned with your visit or with that chiropractor. And that's not fair to you, and it's certainly not fair to the chiropractor either. It's just gas bubbles, people. Sometimes they're not there. It's that simple. Now that we've covered the popping noise and its lack of any significance, and that many do not have the tolerance they think they have, let's cover chiropractors themselves, okay? They're not all the same. Some chiropractors are a lot like patients in that they love to hear the noise. Got to hear the noise, right? They will twist and turn and push until they hear that popping noise. And this is a chiropractor that really doesn't have a firm grasp on things. They really don't understand much about movement disorders and the insignificance of that noise. And some chiropractors, they don't pop at all, believe it or not. Some use an instrument called an Activator that just moves the area slightly, but there's really no pushing, twisting, or popping involved at all. And most chiropractors use a combination of lots of different techniques. Me, for example, I just use light little movements and adjustments for some folks. For others, I use what's called drop tables, which are very gentle, and we use gravity to help us move different areas. And still, for other patients, I will use the Activator that I mentioned before to get movement and to keep any treatment at a very low level of activity there. Now, going to the chiropractor, this is key. Going to the chiropractor is not 0 to 100 miles an hour, meaning that it's not either zero treatment, nothing at all, or 100 miles per hour and twisting somebody's head 180 degrees the other way. There's a lot of middle ground. A good, patient-centered, and experienced chiropractor is able to grade the level of treatment. What I mean is grade it to the patient and their preference. That is what being patient-centered is. It's taking the patient's preference and preferences into account first. That way, we can make the treatment comfortable, gentle, and effective. As long as we're just communicating and we're keeping it tolerable, then everybody usually comes out looking really, really good. And if I'm being honest, and I'm always honest, there are some new patients that get a little sore the first time or two after coming to see us. It can be kind of like going to the gym for the first time in a long time. If you haven't been and you start going, well, you can get a little sore. When one changes the program like that, you can reasonably expect a bit of soreness. I think that's common sense. But it shouldn't last long, and it should be minimal. If a patient does get sore beyond the first or the second treatment, well, our treatments need to be changed because we're not being effective. We can always alter it to something more tolerable for the patient. Plain and simple. It's easy. All it takes is a little bit of consistency and a little bit of cooperation and communication between the two, and you can usually get it lined out to where it's pretty awesome. And honestly, the overwhelming response to coming here to see us at Creekstone is, oh my gosh, that felt amazing. And it typically feels great to go to the chiropractor. It just does. People can't wait to come in here. I have them all the time say, oh, I couldn't wait to get here. I've had patients tell me they wish they'd gotten over their fears or worries and had come in years ago. I've had patients tell me that I saved their lives because I was able to help them get out of pain and get active and encourage them to really engage in exercise and things like that. I've had lifelong chiropractic haters give it a try because their wife made them, and now they're lifelong patients. And they're not lifelong patients because they have to be, or because I talked them into it or scared them into it. We don't do that. They're lifelong patients because they know the difference in how they feel when they come in once a month or once every 2 or 3 months or whatever it might be. So what I'm saying is that the multitudes of benefits of going to the chiropractor far outweigh any small chance of having some mild soreness the first time or two that you come in the clinic. We have a way of making mental monsters out of things that we're afraid of and we don't completely understand. In our minds, they become big, scary monsters, something to avoid at all costs, no matter the evidence to the contrary. And just because they're a monster in our minds does not make them real. Sometimes, if you take a step forward and you give it a shot, you may find that those monsters collapse into a pile of dust on the floor. You may just find a way out of that pain that's been controlling you for so long. You got to understand a couple of big things here. The first thing is, the American College of Physicians now recommends spinal manipulative therapy as a first-line treatment for back pain. That's pretty big. That is a pretty big step right there. 150 people in America die every year due to Tylenol, taking it as prescribed. And up to 16,000 die globally every year. Over 100,000 globally go to the ER every year from taking ibuprofen and Tylenol as prescribed. Now, knowing these numbers and knowing that the RAND Corporation puts the odds of having an adverse event from going to a chiropractor at only about 1 in 1 million, well, then I have to ask, what exactly do you have to lose? Other than your pain, of course. Again, I'm Dr. Jeff Williams right here in beautiful Amarillo, Texas. I own Creekstone Integrated Care, where we've got myself, we've got massage therapists, we have an acupuncturist, exercise rehabilitation, spinal decompression, all kinds of things. And if you've been hurting for a while, we probably have your answer. So give us a holler at 355-3000. Our website is creekstonecare.com. We'd love to work with you.